medication adherence is a huge issue, and it really probably explains in large part why there's a gap between sort of clinical trial data and the outcomes that one gets and then the real world outcomes, and they're never quite as good. I think the most important piece of that is communication and how we communicate with our patients. And so as an example I often use is if you ask a patient, do you always take your medication, they're likely to say yes. If you were to ask, some people struggle with taking their medication all the time, how's it been going for you? Much more likely to admit that they're not taking it, and then you can explore why. I think being non-judgmental and asking open-ended questions to say what are some of the challenges with taking your medication every day. And then I think as we're suggesting to patients to advance therapy, which they often need, and begin new drugs, to really feel them out on that and engage in a conversation. And it doesn't have to be terribly time-consuming, but giving them the option for choice. And so I will often say, there are a few options here, and we could do nothing, in which case, your A1C is high and you have risk of complications, or we could think of a new medication. Here's medication 1 and here's medication 2 and some of the pluses and minuses. What would you like to do? And when they choose the option, they're far more likely to be adherent. But if the conversation is really a very brief, it looks like your A1C is high, you're going to need another drug, I'm prescribing this, here you go. That sadly doesn't work very well, and I think that's why we have the adherence issues that we do. I think another important issue to bring up is cost. It's often difficult for us as providers to know what the cost is for the patient based on their insurance and the various different plans that might exist. I often will tell patients, there are a few drugs in this class, I'm going to prescribe this one, but if you find out at the pharmacy that it's really expensive and you can't afford it, let me know and we can find something else, or we can think of appealing as to why this drug was really the ideal one for you. And opening that door that you're okay talking about the fact that they can't actually afford medications, because I think it's difficult for some patients to bring that up. They don't want to sort of seem like they can't do that, and some are very forthright, but some are not. And so again, opening the door for that conversation, I think, can make a big difference. And the one thing I would emphasize about that is, when I speak to providers, they're often, well, I don't have the time to do that. And I would argue that some of what I just talked about doesn't take very long. I mean, it's like a 30-second to a minute conversation, really. It doesn't have to take a lot of time, and that you have time for, especially if you know that they're not going to be adherent if you don't do that. Well, then you're really wasting a whole lot more time, because visit after visit, they're not getting anywhere and everyone's frustrated.